Hello guys, welcome to my YouTube channel, Dr. Shahnawaz. And in this video, I will talk about the peptic ulcer disease. First of all, you should know that what is the peptic ulcer disease. Actually, the ulcers of the stomach or the duodenum are called the peptic ulcers, and these may cause the abdominal pain and heartburn or other symptoms like that. Um, at the end of the video, you will be able to know that what is the PUD. You will know that the what are the causes of the PUD, the signs and symptoms of PUD. At the end, you will know that how we diagnose the PUD. And first of all, we should know that uh, how the PUD is caused. The most common cause of PUD is the H.pylori, and they this cause the acquired infection in a lower socioeconomic status or in unsanitary conditions, or if there is crowding, the infection is acquired by the H. pylori, and the H. pylori causes the inflammatory response within the mucosal layer, and the inflammatory response is produced by the neutrophils, the lymphocytes, or the plasma cells, or the macrophages, and there is epithelial cell degeneration or injury as a result of inflammatory response. And we should know that the H. pylori causes the gastritis in the antrum if it occurs in more severe form. To confirm that if the patient has PUD with H. pylori, we do the testing that is called the H. pylori testing in all patients. That could be the invasive or non-invasive. The example of invasives is the endoscopy or the X-rays, and in non-invasives, we use the urease breath tests to confirm the diagnosis of PUD. Actually, the other tests like urease breath test or the X-rays, they could be the false negative if the patient is using PPI, except serology. In serology, we don't have any false negativity. Actually, the patients who may be 60 or more than 60, or sometimes in some guidelines there is, if the patient visits more than 45, the endoscopy is indicated. Like we should do the endoscopy for the patients to confirm if there is some ulcerations, if it could be like the GI bleeding could be the complications of the peptic ulcers. And other most common cause is the NSAIDs, and we see that there are different mechanisms of mucosal injuries by the NSAIDs. Actually, what is the first mechanism I discuss here? That actually the NSAIDs are weak acids, and when they come into contact with the epithelial cells, like they have the pH of 7.4, the NSAID ionizes, and actually the ionizing in its ionizing form, they cannot cross the membrane, and they are trapped there, and that leads to the uncoupling of the oxidative phosphorylation, and there is decreased mitochondrial energy production, which uh, could result into the reduced cellular integrity, and the cellular permeability may be increased, due to which we see that there is topical injury, and the epithelial cell may die rapidly, and the superficial hemorrhage or maybe some erosions could be present. In the second mechanism, we see that the NSAIDs cause mucosal injury by inhibiting the cyclooxygenase. Actually, that could result in decreased prostaglandin synthesis that may lead to the mucosal injury. The prostaglandin actually is helpful for the epithelial integrity, and it actually provide and make the blood flow better to the epithelial cells. But if the prostaglandin is decreased, we see the blood flow is reduced. That is the primary mechanisms responsible for the NSAIDs-induced injuries. Actually, in these previous slides, we looked at how the NSAIDs cause the mucosal injury. And what could be the other causes of PUD? Actually, the stress that is related to serious health problem, like when the patients may be admitted to ICU or that, or some older patients, like other stress, that may be some psychiatric problems that could also lead to the PUD when the patient has the stress. The diet, like the caffeine and coffee, may exacerbate the ulcers. And if the patient is drinking alcohol and there is H.pylori problem, that we see that patient could occur the PUD in that case. There's no confirmed if the smoking increases the risk of getting PUD or not. Like the smoking and its correlation with the PUD is not confirmed yet. Continuing to the lecture on the PUD, we will see that what could be the signs and symptoms. Actually, the abdominal pain that is classically present as epigastric. There are two types of gastric acids when we see that presence with the signs and symptoms like duodenal and gastric ulcer. The duodenal ulcers pain actually improves with a meal, and this pain, like abdominal epigastric pain, could awake patients in nights. And as it improves with food, the patient will be eating a lot, and which could result into weight gain. The gastric ulcers, like pain worsens because after food the acid is released in the stomach, and due to which the erosions and the injuries may be increased after food in the gastric ulcers, and the patient will not be like he will avoid eating, that could result into the weight loss. The bloating and abdominal fullness may be as a sign in that PUD patients. The hypersalivation with gastroesophageal reflux diseases could be present in the PUD patients. And continuing to the signs and symptoms, the patient could present with nausea, like in the mucosal injuries that could induce nausea, or the copious vomiting. The patient will be vomiting a lot. And we see that in PUD, there could be upper GI bleeding, that is the most important complication. And after that, the patient could vomit a blood like hematemesis, and that could be directly from gastric ulcers or duodenal ulcers. And the most important complications of the gastric ulcers or peptic ulcers could be the gastrointestinal bleeding, most common complication, and the perforation, a hole in the wall of gastrointestinal tract. And these both complications are life-threatening complications, and there may be death to the patients if these complications occurs in the peptic ulcer disease patients. At the end, we should know that how we will diagnose the PUD, the non-invasive techniques and the invasive techniques. The non-invasive techniques could be the blood test, like the blood sample is taken from the patient and we test for the H. pylori antibodies, and the urease breath test if like the patients ingest a capsule that is labeled with the carbon atom, and when the exhaled breath contains the carbon atom, that we see that the H. pylori is present. And the stool antigen test, patient provides a stool sample to detect the H. pylori antigens. In invasive techniques, we actually use the endoscopy to see the lining of the esophagus, stomach, or duodenum. And in the X-rays, we see that patient actually drink a liquid that contains the barium, and the barium coats the esophagus, stomach, and small intestine. That may be may help us to clearly look at the esophagus with the X-rays. And I have finished this lecture on the PUD.